Do you find it challenging to build trust and rapport with your patients? Are you struggling to explain complex medical information or handle difficult conversations effectively? I'm going to share essential communication tips that will help you connect with your patients, simplify medical explanations, and navigate those tough discussions. I'm Dr. Ariana Demers, and I am leading the way in orthopedic surgery innovation, shaping medical practices for success. So let's talk about effective patient communication. We'll discuss building trust through active listening, simplifying that medical jargon with analogies, and handling those tough conversations with empathy. Plus, learn how to explain procedures more clearly and ensure patients understand all of their care instructions. So let's jump right into it. One of the important aspects of patient care is communicating effectively. As I see it, it is my job to decode the medicalese and help them understand in plain language with straightforward examples. Here are some communication tips for talking to patients. First, let's talk about building trust and rapport with patients. Trust is so important because it forms the basis of that patient-doctor relationship. One of the best ways to build trust is through active listening. This means giving your full attention to your patient, nodding, listening, actually listening, and responding appropriately. My AIscribe has helped a lot with this because I don't have to be clicking and typing. It's recording the whole thing. And then you can show empathy, acknowledging their feelings, and really actually being concerned. And this goes a long way. Additionally, consistent follow-ups and check-ins show patients that you care about their progress. Next, let's move to explaining those complex medical things. This can be challenging because medical jargon and medicalese can be confusing. And one effective strategy is to use analogy that relate to everyday experiences. So, example, when I'm talking about nerve compression, I tell them it's like parking your car on a telephone wire and the information doesn't get there. You can use visual aids or charts or models. Always check for understanding by asking patients to repeat back what they've understood. I always ask, what is your understanding of what I've said in your own words? So remember, explaining complicated procedures using simple diagrams has really made all the difference. So when we're talking about handling difficult conversations, whether it's delivering bad news or discussing a poor prognosis or a poor outcome, these are never easy. But the key is to remain calm and super compassionate. And be honest. If there's any hope, great. But ultimately, being straightforward and not beating around the bush while still being empathetic is really important for maintaining patient grace and dignity. Explaining procedures to a patient is crucial, not only for their understanding, comfort, and cooperation, but from a medical legal standpoint as well. So here is a little guide to help you explain medical procedures more effectively. When discussing procedures, please use straightforward, plain language. Don't use those big $20 medical words so that patients can understand and easily grasp information. Describe the step-by-step, write it down for them if you have to, in a way that's easy to understand using diagrams or models or pictures, and then discuss those potential risks and benefits of the procedure, emphasizing both the positive and possible complications. And then always present those alternative treatments, including nothing. What happens if they don't get this treatment? To provide this comprehensive understanding of all the available choices. Encourage patients to voice their preferences, what resonates with you, what is working for you, and then voice their concerns regarding their options and help make them an active participant in that decision-making process. Make sure you provide all the necessary information and support to help them make truly informed decisions that align with their goals and their lifestyle. So give patients detailed instructions about how to prepare for the procedure, fasting requirements or medication adjustments to make sure that they know exactly how to prepare. And then explain those post-procedure care plan listed out, include activity restrictions, follow-up appointments, and how to promote a smooth recovery without complications. So effective communication with patients is so important in healthcare. Building that trust through active listening and empathy lays a solid foundation for this treatment. Simplifying complex medical information with analogies and visuals enhances their understanding. And when explaining procedures, clarity and simplicity is the key. Additionally, please discuss risks and involve your patients in that decision-making process. Clear pre- and post-injection or post-procedure instructions ensure patient cooperation and optimal outcomes. Effective communication is the key for excellent patient care. So one of the things that we all struggle with in effective communication with our patients is that the system has not been set up for adequate time with our patients. We all know in the insurance-based model, we only have 7 minutes to unload all of our discussions, what the diagnosis is, what that means, what the options are, all risks, benefits, and next steps. Let's be honest, 7 minutes is not enough. And so ultimately, when I was able to transition to a cash-based care model, that has changed how I communicate with my patients. This has changed everything. This has given me the flexibility to effectively connect with my patients and take the time required to make sure that I'm communicating clearly and concisely, but also giving them time to ask questions and for me to make sure that they have appropriate understanding. So you're asking, how did I do that, right? So this has been my journey into the cash-based practice. And honestly, it has been eye-opening. And all of the lessons that I've learned and tips and tricks and experiences I've had along the way, I have been able to condense down into a program called the Business of Orthobiologics. And it is an online self-paced program where I kind of walk you through all of these stumbling blocks and next steps and how you can actually create a cash micro practice alongside your current practice to enhance these patient relationships and help patients understand what to do and how to do it. And now you've spent the time to effectively communicate with your patient, explain all of the pearls and pitfalls and next steps, and what happens if they don't get a procedure or treatment, and what happens if they do, and you can tell them what to expect and kind of future cast what their future may look like if they are able to take advantage of your current expertise and treatments. So please, I created this program for you so that you can have the same experience and love your practice as much as I love my practice and click the link below.